Hello, I'm Jonasz Rewiński and you're watching TVP World Talks, where every word matters. US President Donald Trump has announced the US is calling it quits on the World Health Organization, a UN agenda responsible for coordinating a global fight against both emerging and persistent threats to human health. The WHO will now have to make do with a vastly reduced budget. But what other consequences could this radical move bring about? Are we likely to become more exposed to global healthcare emergencies? Joining us now is Nina Mocior, Head of Humanitarian and Development Aid at Caritas Poland. Hello and welcome to TVP World.
Good morning.
So what do you make of that move? It was something that came to be expected. Donald Trump already was saying that he doesn't really want to stay in the WHO, but it came quite quickly. And right now, we, the international community, have to face the consequences.
Yes, exactly. I'm speaking as Caritas Poland, part of global network of Caritas. And indeed, it's estimated that this will be the reduction of the budget by 15%. And already WHO is saying that the flash appeal, it means, all the required funding is already covered in 40%. So that means that coverage of their programs would be much lower. And, WHO, and especially that we know, humanitarian agencies know, it's also about providing essential medicines, stabilization of the systems affected by war. And let's remember that in low-income countries and so-called global south, the majority of interventions are happening, and pandemics and outbreaks. This is flu, this is polio, yellow fever, cholera, of course, affecting many countries. Ebola, that was the case, right? Coronavirus, that's obvious, and also recently mpox. So it will be affecting emergency response. And let's not forget that we are in the global network. It means when one country, and this is very big country, also a lot of travelers to this country, from this country, early warning systems, access to information, early emergency systems. This is very important that, when we are 194 country and one of the biggest countries is living organization with such a very great scale of migration from and to this country, this will be having consequences. So it's not only a provision of services on the ground, but it's also regulatory systems. Another consequence, very obvious for all of us, when we are losing WHO, which is also coordinating regulatory body, there is a lot of scientists and researchers working in this organization saying, we want to minimize the substandard quality of the medical items. We cannot allow them to be, for example, purchased or produced. So each country is having their own regulatory system. It means that US will be out of the system for some time. So there is a risk, very high risk for substandards, falsified medication, because we have to look at the global market at the moment, not only at national markets. So again, the impact of this decision will be very long-term and very severe for not only emergencies, but also for quality of provision of services, standardization of services in each country, because we are in the global network. So again, it's not only to provide services to emergency affected countries.
So Donald Trump said that essentially the WHO was ripping the United States off. He said that despite the larger population, China is paying less. China is also undermining the credibility of the WHO. He referred to the COVID-19 pandemic and the investigation that followed in order to back this argument. Would you say that this is enough for the US to actually consider that move? Questions of finance and questions of essentially how much contribution do they provide and what they get in return as a country?
Everyone is getting in return, I think that when we look at contributory payments to international organizations, there is this proportion of income versus like the needs of the organization. And let's remember that part of this is ODA, yeah, so this is the development aid indexing. So many countries, they have these proportional percentages of their gross income product to contribute to international organizations as part of their contribution to global development. So yes, as a very high level income country, the proportion might be very striking for them, but also at the same time, this is the solidarity that we are having. Yes, solidarity, it means, when we have more, we would contribute a little bit more. That's the same case for Norway, for Nordic countries, because their gross income, the GDP, is much higher. So the proportion automatically in terms of millions of dollars, it's much higher. And that's the question. I mean, is $120 million a lot or not a lot? Of course, it's so easy to compare to others contributing. But let's not forget that, all these diseases that normally are preventable in our countries are killing millions of people worldwide. So I would maybe call to action to look at this from solidarity perspective, and also our joint in terms of health, because every humanitarian crisis is a health crisis. So now this is the case. Preventable diseases are spreading, and low income settings, they are much more prone to pandemics. So I would call it rather a global solidarity rather than just a case of comparing who is paying more and less.
So would you say that this is a different vision, not only of healthcare, but also of issues such as social welfare, for example? It has often been brought up that while Europeans, for example, tend to prioritize social welfare, in America it has been a different culture. For a long time, you were supposed to fend for yourself in certain cases and to be resilient on your own. But would such a vision, if extrapolated upon the healthcare system and the global fight against, health emergencies, actually work? Do you think that we're supposed to abandon the hope that somebody will be helping us as part of these efforts and this solidarity, and instead basically take care of ourselves?
The primary role as well of WHO is to establish the universal access to healthcare. And yes, European countries, also those countries affected by crisis, we are really loudly speaking and advocating for access to primary healthcare, yeah, as a minimum. And indeed, America, US system is constructed in a very different way, mainly on private sector. Maybe this is why we don't feel it so much. Yes, indeed, in Europe, also in Poland, this is much more clear against social protection. Yes, I would agree here that maybe the way they look at it is much different. For us, having advocate as WHO for universal access to medical health and primary life-saving services, this is of course very well known for us. So this is why, of course, maybe the arguments we are using would be completely different, because we look at a very big picture. Yeah.
And what if another pandemic happens? Do you think that without the US present in the framework, for example, there would not be incentives to pharmaceutical companies to create new vaccines? I'm asking in particular because one particular person in the Trump administration in charge of health has been known to be a skeptic when it comes to the power of the vaccines and the research behind them.
I think that when we have the global pandemic, each country having their own vaccines, I mean, is it really working or not? So, this joint effort and mobilization of scientists around the globe, it is effective, yeah, because this is confusing for many people. Also, in terms of quality, substandard vaccines, this is always very good to have this global leader coordinating efforts. And of course, we are losing so much input from American scientists. The pharma sector is very developed in the US. It's, of course, very growing market. So exchange of science behind pharmaceutical products, different treatment therapies, even devices, medical devices used also in emergencies, also used in other countries, we are losing a lot. Their market is losing a lot, obviously, but we are also, as the world, are losing a lot. So yes, there is a lot of loss. Yeah, like when we look at global network, we say this is multilateral environment, the way we are managing response to emergencies. And let's not forget that pandemic and coronavirus showed us it was transnational. There was no borders for pandemic. So exchange of information, coordination, supply, preparedness and response, those are critical elements of public health and our safety as the world. So of course we are at risk of future pandemic. Also coronavirus is still ongoing somehow with with so many mutation of the virus. So also checking and having very clear understanding how science is proving, and evidence-based treatment therapies, this is very critical always. So we are losing a lot.
And one quick question, because we are coming to an end of the interview. Can you think of a workaround, for example, for companies to continue to cooperate, for a research community to bridge the gaps created by the absence of the data and the knowledge from the US?
So for sure, that would maybe go to private sector somehow as well. Yes, not only WHO as transnational agency, right? But also there will be definitely more countries coming in. Yeah, so maybe European centers, maybe also Chinese, Indian, because there is, also countries who could have very great representation of scientists contributing to this. But having this people from different continents, also people of different, even physiognomy, yeah, for research, to test things in so many different countries, in so many different climates, different continents, there will be some gap, right? So of course, for the representation of research, of sampling, of testing, and generally, to ensure that those are evidence-based therapies and treatments, this representation from North America will be missing, right? But of course, in terms of science, there will be a space to fill in this gap, obviously.
Nina Mocior was our guest today here on TVP World. Thank you very much for joining us and for sharing your insight.
Thank you.
And I'm Jan Ślewiński. You're watching TVP World. Please do stay with us for more latest news and updates.